Welcome to The Queries. This is our second video, and if you're watching us for the first time, my name is Rajri, and in the show every week we bring to you an expert to answer the queries on things that are very simple yet extremely important. Well, before moving on with today's video, let me express immense happiness and gratitude towards all those who showered their love and support on us. The Queries team is extremely honored by the huge response that we got from the upload of our very first video. Well, thank you very much. Keep loving us, keep supporting us. This is just the beginning. We'll definitely try to live up to your expectations. We've received a number of messages, and since most of you have sent your queries on diabetes, we have an expert to answer your queries on diabetes today, and she is Dr. Arundhati Dasgupta from Rudraksh. So here are today's queries and the answers.
Diabetes mellitus, commonly referred to as diabetes, is a group of metabolic disorders in which there are high blood sugar levels over a prolonged period. Symptoms of high blood sugar include frequent urination, increased thirst, and increased hunger. If left untreated, diabetes can cause many complications. Acute complications can include diabetic ketoacidosis, hypersmolar hyperglycemic state, or death. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, and damage to the eyes.
Hello, I'm Dr. Arundhati Dasgupta. I'm a consultant endocrinologist. Endocrinology is a subject which deals with the study of hormones. So an endocrinologist is someone which deals with the disorders of hormones, which would usually be diabetes, thyroid, pubertal disorders, short stature, etc. Today we will discuss about some aspects of diabetes and its treatment. So we have a hormone in our body which is known as insulin, and insulin is responsible for keeping the blood sugar levels under control. What it does, once you take in food, which is glucose, the job of insulin is to push that glucose inside the cell, as a result of which the cell gets its glucose for its energy and the blood sugar levels usually remain low. When the body is unable to produce insulin, that is known as type 1 diabetes. And when there is enough insulin in the body but that insulin is unable to act, a term which is known as insulin resistance, that is known as type 2 diabetes. The number one risk factor for diabetes is genetics, which means to say if you have somebody in your family, your parents, your brothers and sisters, uncle, aunts, who's got diabetes, your chances of getting diabetes is much higher than the rest of the population. The other risk factors are obesity, hypertension, sedentary lifestyle, stress, and dietary habits. Basically, the reason why the number of people who have diabetes is increasing exponentially every day is because we already had this genetic factor, as a result of which we were prone to diabetes, and now we have added on the Western lifestyle, as a result of which our life has become a lot more sedentary. We're eating a lot of junk food, we're under a lot of stress, we're not walking. All of this put together is causing this large boom in the number of diabetics in our country. The signs and symptoms of diabetes can vary. It can present with increased thirst, increased micturition, loss of weight, or maybe just an infection which is not getting healed. Somebody might have blurry vision. But the most important thing to note about diabetes is that a lot of times diabetes can be asymptomatic. Your sugar levels may be very high, and yet you might not have any symptoms at all. And that is the reason why diabetes is known as a silent killer. And that is also the reason why you must check your sugar levels even if you do not have any of these symptoms, if you have any of the previously mentioned risk factors. Normal blood sugar level, if you get a fasting blood sugar level done, the normal blood sugar level should be below 100. Anything between 100 and 126 is known as pre-diabetes. If you're doing a PP level, that is usually done with a 75 gram glucose test, or it can be done after food also if that 75 gram test is not feasible. Anything which is more than 140 is abnormal, 140 to 200 is pre-diabetes, and blood sugar levels more than 200 is diabetes. There is also a test which is known as HbA1c, which senses the 3-monthly glucose average. And if your HbA1c is more than 5.7, that's abnormal. From 5.7 to 6.5 is pre-diabetes, and more than 6.5 HbA1c is considered as diabetes. It is said that if you know about diabetes, you know about the whole human body. That is because almost every organ of the body is affected by diabetes. The most common organs which are affected by diabetes are the eyes, the kidney, the heart, the blood vessels. So we basically divide the complications of diabetes into two groups. One is microvascular, which means when the smaller vessels of the organ are affected, and one is macrovascular. So microvascular is basically when it comes to the disease of the kidney, of the involvement of the kidney or the eyes. Macrovascular is more when it is a complication of the heart or the brain. So if you have a macrovascular complication, you can have a stroke, you're more prone to a heart attack, you can have a peripheral vascular disease wherein the blood flow to the peripheral limbs is limited, as a result of which they can be gangrene. And when you have a microvascular disease, what happens in the kidney is initially there's increased amount of protein passing out through the kidney, and then gradually there is a failure in the part of the kidney to perform its function, and gradually the person goes into renal failure. Diabetes is the #1 cause of renal failure in the world. It is also the #1 cause of blindness in the world because of diabetic retinopathy. So these are the common organs which are affected because of diabetes. But again, as I told you earlier, any organ, be it the skin, the intestine, the liver, any organ can be affected because of diabetes. And that is why it is very important to keep your blood sugar levels under control. Because diabetes remains asymptomatic, people usually ignore the treatment of diabetes till they reach a point where they've already acquired the complications. Here I must tell you that most of these changes are irreversible changes, which means to say that if one of these organs are damaged, even if you control the blood sugar levels later on, it is not going to get reversed. So you have to start treating diabetes properly from day one itself. Another system that is commonly affected by diabetes are the nerves. So as a result of the involvement of the nerves, the patient can have various symptoms like tingling, numbness of the nerves. It can be a loss of sensation. There can be paralysis of certain nerves like 7th nerve, as a result of which you can get facial deviation or drooping of the eyes. And all of this can be attributed to the impaired blood sugar control of the body. So hypoglycemia is basically when the blood sugar levels come down too low. The patient is usually symptomatic. He gets symptoms like perspiration and shivering of the body, and he's very hungry, or he suddenly becomes confused and he feels uneasy. Elderly people might not have any symptoms at all, and they must suddenly just be speaking irrelevantly. So these are certain things. If the sugar levels remain low for a considerable amount of time, then the person might become unconscious, and if that period is prolonged, then the person might even go into coma. So it is very, very important for anybody who's under treatment for diabetes to recognize the signs of hypoglycemia, to know them, to recognize them, and act immediately if the signs of hypoglycemia occur. So actually the target varies according to the person's age. It also varies according to the comorbidities, but grossly if I put it, we usually would like the fasting levels to come down to something around 80 to 120. Again, if it's an elderly person, maybe we'll like to keep it somewhere around 100 to 130, 140. PP blood sugar levels, we would want to keep it in a younger population or somebody who doesn't have any complications. We would want to keep it somewhere around 110 to 140 or 160 maybe. In the elderly population, we can keep it up to 170 or 180. Right? We also target the HbA1c, the 3-monthly average, and our target is usually less than 7 in general, which again varies from person to person. No, if the patient is a type 1 diabetic, in which case the insulin is not being secreted, then the only option of treatment is insulin. But if the patient is a type 2 diabetic, as I just said, we have other options of treatment, and insulin is one of them. So there are certain conditions, like say the person is going in for a surgery, or the lady is pregnant, or the person has a renal disease. In that case, insulin becomes usually the only option, right? There are certain other options, but then usually the common option there. But in certain other cases, like say the person has a very high blood sugar and we initially start the patient on insulin, then we can gradually taper off insulin and then shift the patient to tablets. Also, that's feasible. So there is a common myth that once you start insulin, you have to continue insulin lifelong, which is absolutely wrong. There is nothing like that at all. This myth came in because we usually started off with insulin once the medicines failed, and that was a very age-old concept. Today we start off with insulin based on a lot of other concepts, and a lot of times we also stop insulin after a period of time. So that is very, very individualized in its approach. The treatment of diabetes basically is based on a triad: diet, lifestyle changes in exercise, and medications. So firstly, we're talking about the diet. It's basically about total calorie control. It's not only about restricting your sugars, it's also about restricting the total amount of calories that you're taking in. Now that cannot be fixed for every person. It varies from person to person depending on his or her age, his or her BMI, and what are the associated complications, and accordingly then the changes are made in the diet. Regarding exercise, grossly we say that 30 minutes of exercise at least 5 days a week. Then again, that varies from person to person. If a person is in the geriatric population, we would want the patient, we would not impose very heavy exercise on that person. On the other hand, if somebody is young and obese, we would want the person to exercise a little longer. But at least brisk walking for at least 20 to 25 minutes per day is on an average what is asked for every diabetic person. Next is is where our role comes in as a doctor, about medications. There are a variety of medications that are in use. Every medicine is not for everybody, so there are certain pros and cons of every medication, and accordingly the doctor decides which medicine would be best suited. But one thing that I must emphasize again and again is that diabetes cannot be treated without lifestyle control. So the first thing that you need to do is control your diet and maintain a proper exercise schedule.
That was Dr. Arundhati Das Gupta answering your queries on diabetes. Well, before signing off, I would like to request you to please subscribe to our channel on YouTube, and do not forget to send in your messages and feedback. You can inbox them on Facebook or leave your comment on Facebook and YouTube. Having said that, this is Rajshri signing off.